Good evening, everyone. I welcome you all once again in the episode 4 of Chai Pe Charcha with Dr. Rajat Jain. We'll wait for a second just to check. Give me a second. All right. So, just give me a second just to check whether the voice and everything is fine. Okay, yeah. So, I think the voice, I can listen to the voice, I can see the video. Everything is fine. So today with me in this Chai Pe Charcha episode, I have the youngest robotic gynecology surgeon of India, Dr. Vaidehi Desai Shah. And DVMCI is privileged to have Dr. Vaidehi in our team of experts at eGurukul. We call them as Guru, as a gynecology expert with us. We'll talk about that how the weightage of the OBG as a subject has increased in the next exam. What are the challenges that are there for an undergraduate student, and how she has prepared how she has prepared the things for you so that you can get an advantage in the subject OBG in the exams, and more important than the exam, as an undergraduate medical student who is learning the subject, who can get a great idea about the subject. So welcome, Dr. Vedahi.
Thank you for welcoming. A very good evening, Dr. Rajat.
Okay, so before we start, I just want student can put their comments or put their queries into the comment section. So, Dr. Vedahi, how does it feel to become um, the youngest robotic gynecology surgeon? How tough the journey was, and these students who are aiming or dreaming to become picking up the gynecology as a preferred branch, what is your message to them before we start talking about the actually what is gynecology and how people should study that in the exam?
First of all, thank you so much, Dr. Rajat Jain, for inviting me on this Chai Pe Charcha. Because the first thing I would like to say is that actually, rather than DBMCI being privileged to meet me as the part, I am privileged to be a part of the institution who was the reason, who was a stepping stone to my success as well. Like before I became a robotic gynecologist, I was a gynecologist. I took up obstetrics and gynecology. And if DBMCI would not have been at that particular point of time, I mean, it would have been very difficult for me to crack the dream PG seat which I wanted always. So it is always like this platform has given me, and it is just a give back which I want to give on this platform.
Okay. Yeah, why? And it's always a privilege, Dr. Vedahi, to see the students who have studied with DBMCI and have got great results in the exam and joined us back as as the teachers to guide and mentor students so that they can also achieve their dream. I am also fortunate enough person who has been guided by the great mentors, the great teachers at DBMCI like Dr. Thameen, and now heading the institute. So Dr. Vedahi, there's a common question that I ask from every guest over here, um, that being now a reputed gynecologist in your field at such a young age, when you, and associated with the medical college, when students come to you who are undergraduate students, uh, what do you expect from them, that how much OBG they should know? And if they do not know, what is your aim, that how you ask questions from them in the exam, when you take their vivas, when you prepare the questions for them in the exam, like what are the thoughts that comes to your mind, that how a student should approach OBG as a subject?
Sir, first of all, OBG is a very, very important subject in our country. a country in which whose target is to decrease the maternal mortality rate. So our aim is to teach students such that they can conduct normal labor, they can examine the normal gynecologic patients. We do not expect them to study the fancy diseases or fancy pathologies. But what we expect them is to do a basic examination properly and perfectly with proper precautions and antiseptic ways. We expect them to understand how a labor room is, how to monitor the progress of labor in case of obs patient, how to determine that the patient is progressing properly, how to plot the partograph. See, doctor, sir, it is like that. That if a nurse can do the job properly, a doctor should definitely know how to do his job properly. So, you see, doctors give instructions to nurses only when they themselves know what is right and what is wrong. So, I expect my students to understand the normal progress of labor, to monitor the patients in labor, to conduct basic normal delivery with full confidence, do the routine procedures like episiotomy, neonatal resuscitation, which is very, very important. And when it comes to gynecology clinic, I expect them to basically do per speculum examination and per vaginal examination properly. These are very simple things which I expect them, because if you know simple things, then you can move on to the higher things.
Definitely. So, Dr. Vaidehi, how you have addressed those issues in your e-Gurukul OBG? How you will make the OBG simplified for the students who are relying on to the e-Gurukul, so that considering the changing pattern of the exam, like a next exam, what is expected from the students? So, how those issues will be addressed? Like, if you want to show some slides, anything like the way that you want to explain over to you.
I feel, sir, I have seen at many places that they are showing very fancy videos and like fancy surgeries and everything. But what I think is it is not going to be beneficial to the students. What is more beneficial to the students is that to start from the very basic, like to clear the concept about obs and gynae. I mean, obstetrics and gynecology needs, it is a very important subject. It is as important as medicine or surgery, I must say. To clear the concepts is very, very important. Most of the students are not clear with the concepts of obs and gynae. So in eGurukul 2.0, I have started with the basic concepts of obs and gynae, and I've tried to simplify them in a very beautiful way that the student can remember forever. First thing. Second thing, after simplifying the concepts, I have added on to the technical details of obs and gynae in a step-by-step manner. If you want to climb a ladder, we will climb the first step and then we will go on to the next steps. Similarly, I have started with the basic concept, then I have added on to the technical details. As we go along the lecture, towards the end of the lecture, I have covered even the latest guidelines from the standard international textbooks, which are internationally recognized in obs and gynae, as well as the guidelines from the International Society of Obstetrics and Gynecology, like American guidelines and RCOG guidelines. So a student can get the complete overview of obs and gynae. And we are also going to provide them the clinical videos from the basic part, so that they at least know what to do when they enter the obs and gynae clinics.
Wow, I mean, using the latest guidelines specifically from the standard, organization. I mean, that's the best thing that can happen, because over a period of time, I have experienced that whenever there are changes in the guideline, they always are the hot topics, and they are the one that are very very frequently asked in the exam. People are already happy, and the students have started messaging about the way that you have explained the things.
Thank
So
you,
my
sir.
next question to you, Dr. Vedahi, is about like you said, the clinical videos. Now, before that, you mentioned that these are the things that an undergraduate student should know. Over a period of time, my experience says that the way that the next exam is going, now their basic aim is to see how an undergraduate student who has become a doctor is able to handle the things if that student is left at a primary health center. And when you look at a primary health center, the pediatrics, a basic pediatrics and a basic OBG, what we call as a maternal and a child health is the first thing that comes into existence. I feel that the two subjects which become important, one is a maternal and child health, and the second is a community medicine, specifically when you're looking at a primary health center. So my question is that how you will be addressing those specific issue in terms of clinical video. Like everybody keeps on saying the clinics. What clinical part have you covered in your e-Gurukul video, and how they are different from what you have mentioned about the fancy videos that you were talking of? How they are different in that sense?
Sir, it is very simple. I can either show them my me doing a robotic surgery, or I can show them how to do a pelvic examination first. It is very simple. See, I have not become a robotic gynecologist at the first. I have become an obscene gynae first, and then I did my fellowships and diploma in laparoscopy, minimal accessory surgeries, and then robotic surgery was my last fellowship. I cannot, if I want to teach someone, I cannot teach them from the last destination. I need to take them from the first step. So this is what I have done in my clinical video. I have started from the very basic examinations. I'm going to slowly add on to the clinical videos such that if they are left unmonitored, I mean, if I am given a choice, like what kind of assistants would you like to choose? My students would be such that I can rely upon them. I want that kind of product of doctors to be made from eGurukul 2.0. Quality doctors.
Very,
That is
very
what I
well
want.
explained, Dr. Vedi. Very, very well explained. In fact, I'll tell you in the morning what happened. That today I was reporting a TM joint MR. One of my resident has reported it. So it's a temporomandibular joint. The basic aim of doing that MR was the patient was having a click sound whenever he was opening or closing the mouth. So there was a problem with the articular disc. And there is a
Yes.
specialized study, what we do with the specialized coil on the MR. So when I was reporting that MR, it came to my mind, let me do one thing. The student will not understand the things in a way. Let me read out the temporal bone open mouth and a closed mouth MR with hi-fi sequences with them, and then they will say, "Oh my God, such a great radiology that they have sir has shown," without without understanding that that thing can never be asked in the exam. So we don't believe in teaching those things which are not asked in the exam. But let's hope that the students get that sense as early as possible so that
Yes.
they understand that what is being asked in the exam and what are the things that should be taught. There are people who have taught the subject like a radiology for half of a century. And I mean, I don't have words, but anyways, leave it. So the point is, okay. So there is a question for you, and that question is that is DC data is sufficient as an undergraduate student, or the student should think about Williams during the MBBS?
Sir, Williams is something that is internationally accepted. I mean, I feel personally that is my personal thing. Of course, there are people who won't agree to it, but I feel that at an undergraduate level, Williams is necessary because Williams was something which I read even my undergraduate days, and Harrison is something which I read even my during my undergraduate days. When we are talking of the quality education, and when we are talking about the genuineness and the authenticity, these things are endorsed by the standard international textbooks. Unfortunately, none of the Indian textbooks have got those internationally accepted authenticity till date. That is why I recommend that international textbooks should be followed.
Yeah, but I feel that they are more of a considered as a reference book, because if a student has read an Indian book and has seriously attended our classes, whatever are the internationally accepted guidelines, we are there to cover them in the classes. And if a student has read a cover to cover a Datta and Shaws for that matter, and they are very very serious with the classes that we have done at DBMCI or have attended your videos or like thoroughly your videos, because I feel that whatever are the internationally accredited classifications or the updated modules, be it from Williams or maybe from some other higher area, they will be very very well covered with us. But yes, if a student is planning to read on its own without taking any help from us or from any other place, then you may have to go to the higher books.
One
But
thing what we can do for them is that because they do not have that enough amount of time that they can go to the reference books of each and every big subject. But that is why what we are doing in Ari Gurukul 2.0 is whatever they are studying in their MBBS curriculum, whatever they're comfortable with, they can study. But when it is a time to when they are confused, when they are stuck, like which what is right and what is wrong, that is the time when we intervene, we guide them the correct way, that what this is the standard thing and that you can follow. We are doing that job, we will try to make their lives easier by, like, by
Yeah,
taking
exactly.
like,
Yeah,
by referring
I mean,
everywhere and
yeah.
giving them a concise handbook. It's like a concise handbook.
Yes, I mean, if a student asks me that they want to read on their own, then what they should read, then probably I would have said that yes, the Williams is must for you, beta. But
Yes.
now, see, that's the whole idea that we are available, that so that we can decrease your workload. No, that's the whole idea, to make the things simplified and to make the things easy for you. Okay. So moving on further, Dr. Vadahi, there is a question for you. Discuss the perks of being a gynecologist. I mean, career in OBG, pros and cons. What are the things that you think have done good because you joined OBG, and what are the things that you regret that you are in OBG which you don't like? So I mean,
I
if
feel
you are
very
hoping for the
sleepless at
OBG as a
times.
career,
That is what I regret about OBG.
what? Sorry.
I feel very sleepless at times. Though I want to sleep, I couldn't sleep. So that's, I have compromised on my sleep. That
So
is
it's a
what I
hectic
regret
branch.
about OBG.
It's a hectic branch, right?
It's a very happening branch, I must say. I mean, anything can come at any time. You must always be ready on the clock for emergencies, and
So
like
that
it
is
is a very
pros for
challenging branch.
somebody, cons for somebody, I feel.
Sorry.
When you are always in demand, so if you are in demand, that's a pros for somebody, cons for somebody who want their me time, who want their own quality of life, who are like chilled out people in the life. For them, if you are on demand, it I mean, it is a con for them. But the people who are like pastry personality, who always want to be to get attention, who want to get a lot of recognition in the society, who want to get name, fame, money, then probably it's a pros for you. I mean, this
Obs
speaks.
and Gynae is a very rich branch actually, but less rich compared to radiology, sir. We are
Yeah.
less richer compared to you.
I mean,
First thing.
I still remember when you talk about earning money and all. So I still remember my conversation with Dr. Praveen once. Dr. Praveen is a pathologist, I'm sure the students know. So we were taking a counseling session after the students got ranked. That sir, which is a good branch, how much money you can earn in a branch, and all and all. So Dr. Praveen said कि बेटा एक बात समझना, ब्रांच पैसा नहीं कमाती, इंसान पैसा कमाता है. It's the person who earns the money, not the branch. So I mean, there is a potential in every branch, and there are people who are not able to earn in any branch. So it depends on a person rather than just on the capacity of that particular branch. And we have seen that over a period of time. I have seen radiology being frustrated in life, and I have seen people of non-clinical and the paraclinical branches earning money like you can't even imagine that. I mean, a lot of people know. You can put it into the comment section about the names. So, anyways, okay. So, Dr. Vadahi, what about some good points about the gynecology when you picked it up during the undergraduation? Sorry, in the post graduation. How hectic was it? And specifically about any XY, any male who is taking up a gynecologist as a brand. So, what is your take on that, Dr. Vadai?
Actually, sir, the place where I had done my post graduation had a 50-50 ratio. Like, 50% were males, 50% were females. So we did not face that gender bias when it comes to obs and gynae. But yes, there are places in India for which, like, male gynecologist, it's very difficult for the male gynecologist to practice. Like, there are some orthodox, like very conservative areas in India as well, in which it is very difficult for a male gynecologist to sustain. But the pros and, like, the prospects of a male gynecologist are as good as that of a female gynecologist.
Yeah, so
First
I
thing.
know.
Second thing,
Yeah, so I know one of my very close friend. He picked up gynecology at the rank 33. and he completed his gynecology and he married a gynecologist. So both of them are gynecologists, and so then they both did fellowships. And my friend, he did fellowship in genetics, and now both are very popular gynecologists in Delhi, running their own IVF center. And the male gynecologist is more into embryology, in the ovum pickup, and doing the all this aspect. And the couple, the gynecologist, the ma'am, she's more into basically the he was my batchmate, the male gynecologist, and his wife is our senior. So he married a senior in MBBS, which is a slightly rare phenomena. And both are doing phenomenally well. I mean, in the practice. Yes, the time was tough in Delhi in Maulana Medical College, being a male gynecologist, as Dr. Vedhi is rightly mentioned, that there are few orthodox community where it becomes a challenge. But yes, I mean, the right now, when I speak to them, is very good. I mean, so that's there. I think Dr. Vedhi has lost the connection. She'll be joining us in a minute or so, but till then I am gonna take questions. So Paras, beta, if you ask me, I think you all know me. I did my MBBS from Ranazad Medical College. Was able to perform pretty decent in my exams, and as an undergraduate MBBS student, and as well as into the postgraduate exams. I can tell you that I have never seen Williams. That is what I can say. The only book of OBGs that I have read was Shaw's and Datta, and obviously plus something that have been taught to me by my teachers in my institute. That's all. Apart from that, I have not touched any other book of gynecology ever during my MBBS. Definitely not during my MBBS, and obviously not in my post graduation being a radiologist. Yes, after doing radiology, when I was doing the senior residency, I have referred Williams sometime for like to study about when I am seeing a gynecology case or an OBG case, but otherwise I have not yet. So do not worry about it if you have never touched Williams. Most of the time we try in our classes, in our lectures, that if something is an important information that is from an international title, to cover them in and out, so that those who are apprehensive about that particular part, or there are a few important stuff that is very well covered. So don't worry about that particular part. Just give me a sec. Is there anything X, Y, Y, Z with that question? Ask the doubt, bro. Okay, yeah. So I think I have lost connection with Dr. Vedahi. Uh, just give me a sec. Yeah, okay. Yeah, that's okay, Paras. I mean, that's these are the informal sessions that we are conducting. You can ask anything about the branch that you want. I mean, that's absolutely fine. I mean, you can ask questions about our personal life also. That's fine. These are non-academic, unofficial sessions that we are doing at DBMCI YouTube channel, so that we can give you some more idea about how the branch is, and we can talk to you. We can address to your concerns that you have. So I think she has lost connection. I'll just try so that she joined back. But till then, I'll tell you that in Gurukul 2.0, we have tried to cover these subjects in a way which can help you in becoming a quality doctor. And as I always say, that when it comes to the next exam, or for that matter, when it comes to any clinical pattern of exam, be it NEET also, you need not to worry about that. You can leave all those worry on us. I mean, you have to trust us on that particular part. Leave all that worry on us. I mean, there are few aspects whenever you change such a technology, it takes just give me a sec. Yes, so she has joined back. Okay. So we have tried to cover the subject in a way, as I told you, that which is more than sufficient to crack your exam help you in becoming a great doctor. Trust us on that particular part. I say this with confidence. If we have not covered anything, that is not important for the exam. Okay. We have not covered anything that is not important for the exam. So you need not to worry about that. Just give me a sec.
Just a sec. Yeah. I think, yeah, it is fine now. Yeah.
Yeah. Okay. Welcome, Dr. Vedi. I think you lost connection.
Yes, yes. There was some problem with
That's
the
okay.
connection
That's
actually.
okay. I mean, that's always there.
Yeah, it is fine now. Yeah.
Okay, yeah. So guys, as I told you that this type of Charcha is gonna be there with every faculty. Law soon, Dr. Sushi from Ortho will be here. Dr. Neha from Ophthalmology will be here. Dr. Praveen from Pathology. Dr. Thameen, Dr. Ashwini, Dr. Jay, all will be here in some time as the time is gonna come, because every session we are taking the session with one. There are many more non-academic these interviews where we can get slightly more relaxed and can get some more idea about the branches, etc. So there are a lot more sessions that are being planned. Okay, so pros of OBG, Dr. Vedri, we were talking about that. XYYZ has asked this question. Nice name. So what are the pros of taking OBG?
His name should be XYXX or XXXY. Then it would have been a better name. Because when
Yes.
it comes to OBG, that should have been his name. First thing, it is always a very good and fruitful branch. This is the only branch in the entire medicine which will give you the joy of dealing with and giving two lives. You know, it is the joy where you are going to take care of two lives, not just one life. So it is the only branch in the entire medicine. It is a very beautiful branch because whenever we deliver a baby and we are the first people who are holding that baby, so it is a very beautiful, it is as if we are bringing a new creation to the world. So it is actually a very beautiful branch from my angle if you see.
मेरा एक बहुत छोटा सा बोलना है ओबीजी ब्रांच के बारे में. इट इज वन ऑफ द वेरी वेरी फ्यू ब्रांचेस इन द मेडिकल फील्ड जहां पर पेशेंट खुशी के साथ आता है.
यस, गुड न्यूज के साथ आता है सर.
है ना?
बाकी
जहां
हर
पर
जगह
पेशेंट खुशी के साथ आता है. अदरवाइज मेजॉरिटी ऑफ द टाइम पेशेंट कम्स इन अ डिप्रेसिंग मूड एंड या डॉक्टर के पास जाना पड़ेगा. ठीक है, तो ओबीजी एक ऐसी ब्रांच है, व्हेन स्पेसिफिकली व्हेन यू टॉक अबाउट ऑब्स्टेट्रिक्स, ऑब्स्टेट्रिक ऐसी ब्रांच है जहां पर इंसान खुश होके आता है. आई मीन it's an amazing chart.
truth.
That's the biggest pros. And one thing that I can tell you, this is one brand that can never go out of fashion. Like a lot of people keep on
दे
saying
से दैट जब तक सूरज चांद रहेगा ऑब्जन गाइनी जिंदा रहेगा. जब तक सूरज चांद रहेगा ऑक्सीजन का नहीं जिंदा रहेगा.
Okay, so a very important question, Kaustav, that you have asked: how to limit ourselves while reading as many times. And as I read many times, I tend to read things into depth and spend a lot of time in a single topic. So, Kaustav, beta, this is the biggest challenge in your preparation. Now, when a lot of people ask me, like there are a lot of sessions that I do, and that there are honest sessions which are not linked to the DBMCI, not linked to the eGurukul, which are between me and the student. When they ask me some the advices that for which they are, I am not known for those sessions. So, if you ask me one session that is honestly that do you need a coaching? Every student need a coaching. My answer is no, not at all. Every student does not need a coaching. It depends on your understanding, it depends on your level of motivation, it depends on the kind of guidance that you have got from your senior, etc., etc. There are many factors on which it is dependent. So this is the biggest role of coaching, that we decide not what to read, rather what not to read, where to limit you, where to stop. That is the point which is decided. I say that in this world of technology, you are not attending any coaching institute for the knowledge. Knowledge in the world of technology is available at a click of a button. Google has got much more knowledge of radiology than what I have. Google has got far more knowledge of gynecology or on OBG, which Dr. Vedahi has. I mean, your
Yes.
smartphone with an internet capability has got far more knowledge than anybody else put together. Like 10 people put together. Then why do you need us? You need us because we are the one, that smartphone that Google will not decide where to stop. And that is what we do. We decide, we tell you that beta, you have to stop here. And that's an unfortunate part that has started happening, is that lot of teachers also have stopped deciding when to stop. और आपको ये बात समझनी है कि आपको कब रुकना है. Why? Because knowledge has no limit. I mean, there is enormous knowledge that is available, but you have to read 19 subjects in a given amount of time, and you have to recall them in a given amount of time. So that is challenge. Okay. All right. Yes, definitely males are definitely allowed to do OBG. I mean, there's nothing called as not allowed. I have already given you an example. Um, Rani Beta, I think Dr. Vede has already told in detail. Just scroll back the video previously and you will see that what videos, clinical videos have been covered. Uh, okay, Bhavik, how do I know I am made for this department? Like be it surgery, radiology, ortho, etc. Okay, so Bhavik, get a rank and then give me a call. We will definitely talk about it and I'll tell you that to decide whether you are made for a particular branch or not. There are a few set of questions that I ask from every student who has got a rank and is confused about which branch to choose. And I think those set of questions will give you an answer. Okay, but first get a rank. We'll talk about it later. Is it what we have to practice OBG and gynecology together? We can study further separately. I mean, I'm sorry, I'm not getting this question. Can you elaborate it more? ओके सो चाय में कितने चम्मच चीनी पीते हो? आज तो चाय पी नहीं पा रहा बेटा, बट डिपेंड करता है कि कितना मोटिवेशन है वेट लूज करने का है. सो एक जमाना था जब मैं बोलता था हम खड़ी चम्मच की चाय पीते हैं, but धीरे धीरे समझ आया कि that sugar is very bad and it is not the fat or a cholesterol that is bad, it is actually the sugar that is bad. So I have slowly decreased my sugar, and last year I reduced it to zero, and I think for almost 150 days I was without sugar, and a very disciplined diet, and as a result I was able to lose a proper balanced diet, being a Jain, not eaten anything non-veg. I mean, for the 35 years of my life, but started eating non-veg at the age of 35 to get more protein, less of carbohydrate, and able to lose 14 kgs. But then all went off again. The motivation went off. Corona took all that away, and again back to 76. Again, from that zero sugar, it is back to 1.5 teaspoons. But now I am again trying to reduce it back to half a teaspoon to zero. I mean, by the time you're gonna be writing your exam, if you're writing the NEET PG this time, I will try to get back to my own schedule. Yes, let's make your own Google. So yeah, so that is why we have created the medical Facebook onto the eGurukul app, so that you are not wasting your time here and there and focused onto the studies. Uh, um, so recommended clinical book for OBG as a UG if a student is associated with us, Dr. Vedai.
Recommended UG book.
Hmm.
See, there are many UG books available. I won't prefer one book over the other book. It always depends upon the student preference. Like a student should understand the language of the book, and a student should be comfortable with the format of the book. Each student has got a different kind of comfortability when it comes to reading books and understanding the things. So I leave that choice only on to the student, because whatever is good for me, whatever is is acceptable to me may not be acceptable to other students. But yes, datta is usually the one which is usually followed by the Indian students, but there are also other good options as well.
So any specific book that you still want to mention? Say, I feel I have read Shaw's and Datta during my time, and I feel that they are pretty decent books even now. I mean,
Yeah.
as a blanket books, if you read them and you cover our classes,
That is more than enough. Yes, that is
That
more
is
than enough.
more than enough to get a gold medal in your subject. That's all.
See, they are going
And to solve
Shaws,
exam.
yeah, Shaws and Dattas are going to cover the UG things, and the rest of the things are like from, like for example, from Gynae we are covered. We have covered from Barrack and Novak's 16th latest edition, which came in 2020. We also covered from Speroff's International Textbook of Infertility and Reproductive Endocrinology. We have also covered from Williams Obstetrics 25th edition. So we are always there to add up. Like
Yeah, and
we are
whichever
giving them.
are important updates, that's our role now. I mean, there are some basic book that you have to
Yes.
cover to get the basic idea about the subject. And as far as the updates and the important things are covered, you are with us. We have taken your responsibility, so why you are worried? Don't worry about it. All right.
True.
All right. So that's all. How are the subjects divided according to the score? Beta, if you're talking about the NEET exam, there is part A, part B, and part C. Part A is clinical, part B is paraclinical, and part C is clinical. If you're talking about next exam, the whole together it's different because it's a 3-day exam. I mean, you just go back and scroll the videos of the YouTube channel. You will see a video by me or by Nachiket on this about the details of the next exam. Okay. All right. Any message that you want to give to the students, Dr. Vede?
My message to students is that don't worry about what exam is going to come and how is going to be the pattern, because we are going to be for that. Just concentrate on your hard work, because it is your hard work which is going to speak and it is going to give you success. Believe in whatever you are doing and it is going to create a miracle one day.
Wow. Yeah, good. Great, Dr. Vedai. So, a student has just written that he has read OBG with DBMCI in the final year and got 71%. As a medical student, 71% is a very, very good mark. Congratulations, dear. Okay. Students are asking about the clinics. Any book available for OBG in clinics?
Yes, there are so many books, but most of the books are of like PG postgraduate things, like for students who are already into the residency and everything. So for that, books are available. So what we are trying to do in eGurukul 2.0 is that we are going to simplify whatever is important from the undergraduate point of view, and that is what we are going to give you in clinical videos, which are going to be uploaded soon.
Okay, thank you. Thank you, Dr. Vedai. There is a question, I think it's from me, Rani. Sometimes I feel out of concentration, how to avoid it. Rani, I will say only one thing that I have sent this message to the Telegram also to all the students, and that is, if your dream is close to you, you cannot lose concentration. I mean, you simply cannot lose concentration. Your vision will pull in. Your vision will pull you. So if you are losing concentration, there could be only and only one reason, and that means your dream is not true to your heart. Your dream is definitely not true to your heart, or you do not believe on that particular part. अगर आप उसके ऊपर बिलीव करते हो तो ऐसा हो ही नहीं सकता कि आप कंसंट्रेशन लूज कर जाओ। और अगर फिर भी करते हो तो उसको ना, उस ड्रीम को एक पेपर पे लिख के जहां पर आप हर रोज डेली देख सकते हो उसको लगा दो। तो जब कंसंट्रेशन लूज करोगे एक बार उस ड्रीम को पढ़ लेना, कंसंट्रेशन वापस आ जाएगी। और अगर वापस नहीं आ रही तो इसका मतलब आपने सिर्फ ऐसे ही लगाया, वो ड्रीम है ही नहीं। वो सिर्फ आपने अपनी गर्लफ्रेंड को, अपने पापा को, अपनी मम्मा को, अपने फ्रेंड को, किसी को दिखाने के लिए लगाया है। दैट इज नॉट योर रियल ड्रीम। इफ यू हैव अ ड्रीम, यू हैव अ ड्रीम, ऐसा हो ही नहीं सकता कि आप कंसंट्रेशन लूज कर जाओ। आई एम वेरी वेरी क्लियर ऑन दैट पर्टिकुलर पार्ट। सो गेट फोकस्ड इन लाइफ। ओके, ऑलराइट, ओके। So that's all from our side. If you have some questions, just let us know. Otherwise, we will stop today. I do not have my own chai, so I have to go back. And nowadays, I have started doing intermittent fasting. I'm not eating anything for the 16 hours in a day, and I'm eating only for the 8 hours. So I'm just trying that. Let's see. A lot of people, a lot of my friends have recommended. Initially, I started that previously also, and it worked. So I'm trying it nowadays. So let's hope it works. Yes. If you have some questions, just let us know. Otherwise, we will call it a day, and we will close this episode 4 of Chai Pe Charcha. Thank you very much for great questions. I think I enjoyed the session a lot. I mean, student have asked the questions, and please do keep on asking the questions, and do let us know in the comment section who's the next faculty that you want in Chai Pe Charcha with me, and I will invite those people. Okay, all right. Thank you very much for your time, Dr. Vedri. Thank you everyone for
Thank you
joining.
very much.